Thanksgiving is almost upon us. It's a wonderful holiday, unless you're a turkey. It can be a busy day in the emergency room, too, with Thanksgiving-themed ailments like food poisoning and burns. But the big takeaway is that showing gratitude is good for your mental and physical health. So what are you grateful for? Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. David, we're kind of sending mixed messages here. You basically added an adult warning for Thanksgiving. This is my favorite holiday. I love the idea of bringing people together, bringing the family together. And you're suggesting poisoning and burns. Is this really a problem?
John, like anything else, it's sort of like, you're going to have your fun, but it's going to be better if you got the warnings ahead of time. So I think this will be either...
I don't know about your family gatherings, David, but go on and share more about what happens around poisoning and burns. This is sounding like sort of a Shakespearean drama in the Williams household. Is this a common problem?
Well, let's set the table, so to speak. So, John, here's a little question for you. How many calories do you think people consume on Thanksgiving typically?
2,000?
Yep, double it up and you're about right. So the recommended number of calories for a typical adult is about 2,000 to 2,500, depending on the person. And they say that the typical Thanksgiving dinner is about 3,000 calories just for that. And plus people pack in at least another 1,500 overall and sometimes more. And so that kind of shows you where things stand for. Now, the good thing is it's not Thanksgiving Day, every day, but it's just a big, big starting point. But John, so one of the things that happens around the holidays is statistics are a little muddled on this, but there seems to be a boost in the number of people coming to the emergency room. What would you guess would be some of the reasons? Let's go back and forth and see if we can identify them.
Car crashes. I mean, little too much beer and wine at the dinner table. I mean, that would be my guess. Sort of partying leads to problems. I mean, what is the leading?
That's right. I mean, one of them is actually food poisoning, John, because the turkeys, people get a frozen turkey. It's bigger than what they're normally cooking, and it takes a long time to thaw it out and then to cook it. And people cut corners on one or both of those. So either they don't thaw it long enough, they don't cook it long enough, or they actually leave it out and warm it up for a long time while it's thawing. So food poisoning is a biggie.
Do you have personal experience in bungling the turkey?
I don't have that experience. Usually I'm one of those where a backseat driver, whereas I may raise this as a concern for others, but no, I haven't done that myself.
Well, make sure you turn the dial to at least 325 as you're heating up and thawing your frozen turkey. But what else can go wrong as I trundle up the road to my mother's house and bring everybody together? Like what else goes bang and
the closest thing that goes bang, John, is that there's a lot of people trying to cook turkeys in a different way, and I actually saw this a few years ago in the Wall Street Journal, where people would take a turkey and do a deep fat fry. So rather than waiting forever, turn the dial to 325.
So the good news here is everybody's eating 3 times the amount of caloric intake that they need, and so what do you add? Deep frying.
But the thing is, John, it's so big that people will put it outside, and it's okay if they put it in the lawn, but sometimes it's a little cold at Thanksgiving, so they put it on their porch. And then not only does the turkey get burned, but you could burn the whole house down when the huge barrel of oil explodes. So burns is a big issue too, John. And also cuts and lacerations. Now, this is usually for like carrots and potatoes are pretty hard. So you're cutting those up. And also
amateur carving award is a puncture wound.
Carving the turkey is a separate type of a wound. That's usually not like a finger wound. That could be something more serious into the hand. But you're right, John. Overeating, alcohol poisoning, those are big ones. Also, overexertion. Some people who are not very active during the year, they feel they got to run around and get the turkey ready for all the people coming, like demanding people, including yourself. And me, who might be arriving, and somebody who have asthma or a heart condition, they could just overdo it.
So you're kind of putting a whole pall on this whole Thanksgiving thing. What's good about Thanksgiving?
Well, Thanksgiving is great, John. I'm going to stick with this theme for another minute. So, the one of the things that also happens, there's some things that happen like after the meal. There's some things like the preparation and all that. They may bring to the
You mean
emergency
you
room
mean
during the
you
day.
mean that the disasters don't stop at
Right.
dinner?
That's right. So first of all, what happens is people are like, "All right, mom or grandma, this is all good. We'll have our dinner, but then we're going to take you to the hospital because you've got some, festering wound or something like that." So people come and
Oh
they
God.
see people that they
What kind
haven't
of
seen
sick mind? This
in
is exactly
person,
what people worry about with
and then John,
healthcare
the next
people.
the next day, the biggies. Now I'll stop after this. The next day, the biggies are out of control diabetes, atrial fibrillation from you just like completely overeating, overtaxing the system, bowel obstructions. You'd like that one. And then car crashes, John. It's usually going home that you have the car crash, not on the way there.
From the ER. Well,
Yeah,
David, now that you put a complete pall over my favorite
yeah.
holiday, family, friends, time together, and it sounds like time in the ER. What's good about Thanksgiving? I mean, does your family have any positive reflections on Thanksgiving other than healthcare deterioration, decline, and disaster?
So we do have some doctors in the family, and some of them actually love to talk about, some of the gory stuff that they've seen. So I think, let's not say what I said before was negative, but John, really, why
It's
is
pretty
thanks?
negative, actually. I mean, I know, your family may be unique, but and I don't think it's typical. But no, that's pretty dark. I think it's good for people to know where we're warning our listeners that there are some things that can go wrong on Thanksgiving. But let's face it, David. This is the many people's favorite holiday for a
Exactly.
reason because this whole gratitude thing is just we don't have enough of it in our society.
Yeah. So, I think gratitude is actually very good for you. And there's a reason that people like Thanksgiving so much. And it isn't just the turkey and the potential for bowel obstruction. It's that gratitude is a great feeling. And, there's actually research that shows that gratitude improves both your mental and physical health. And there's the concept that behavior changes biology. So having a day that's actually set aside for Thanksgiving for gratitude is a positive for your overall health in the most holistic way.
Well, it actually is pretty robust in the psychological studies that a daily gratitude practice of any sort, it could be a religious one or it could be one that is just a celebration and appreciation, is something that is actually highly tied to better mental health. It sort of comes across as somewhat woo woo, but it is all of the motivational research, a lot of the psychological research, all ties back to the notion that expressing gratitude in a centering way through either meditation or just reflection really has a strong impact on mood. And to your point, there's increasing evidence from Mayo Clinic and others that there's almost a psychobiological connection between that gratitude. I mean, I'm not particularly grateful for hearing all the things that go wrong in the ER, but I am particularly grateful for the friends and family we've all pulled together, those who can, over Thanksgiving. And I think that it's a reminder of the power of this practice, and that and that our learning, really the science behind it is at an early stage, but it's very consistent that gratitude drives really, really a much better psychological outlook.
So they say that from some of these early studies, as you mentioned, gratitude can reduce symptoms of depression and anxiety and stress. And considering that the alternatives are just living with that or taking medications that aren't 100% effective and have side effects, that's a very positive outcome. On the physical side, you'll see that it could lead to better sleep, lower blood pressure, and stronger immune system. So those are all positive sorts of things. And you mentioned about having specific
But
practices
they're
of
but they're
gratitude.
but they're powerful, David. I mean, if you can lower, I mean, we spend billions of dollars on drugs to lower blood pressure. Cardiac disease is still the leading cause, I think, getting cancer, the leading cause of death in America. This is free, but takes time and focus. Not a lot of time, but a little bit of focus, and it literally can replace pills for many people.
So John, so that's one day a year, and do we need 3,000 calories to get at it? You were mentioning something about gratitude practices mean, how does Thanksgiving relate? Or is this like something that you need to do and just like one more item I need to put on my to-do list?
Well, I think the way to think about a gratitude practice, and certainly the research bears this out, is it's not about one day. I mean, one day a year is great, or is good. But what's powerful is when you can build it into a daily practice, even if it's in a small way. It really can change your biology. It's not going to change your. It's not going to counteract the effect of your 6,000 calories, David, or your visit to the ER, which will undoubtedly raise your blood pressure. But a daily gratitude practice where you express appreciation for the people and things in your life and can be reflective on a consistent way in a over a longer period of time really does have a direct effect on your biology. And I think maybe the lesson from Thanksgiving, sort of separating one chapter away from your disasters associated with mistakes to avoid and places not to go on Thanksgiving, is to take one of the reasons why everybody, or not everyone, that many people experience Thanksgiving in such a positive way and try to build that into more of the everyday. At a time, particularly when so many people, there's so much anxiety and unkindness in the world, and certainly social media is, uh, peppering us with bad news. Maybe it's even more important for all of us to find our own paths to some form of a gratitude practice that we can practice every day.
I try to do is a couple things. One is, and I don't do this regularly. I don't do this daily, but if I'm in a situation where I'm kind of down, I'll think of at least one or two or three things that I'm grateful for, like at the end of the day, before going to sleep, and it can sometimes chase away some of the sort of negativity. And then also just saying thank you and expressing gratitude to people, like my wife, that I always appreciate, and I assume she knows I appreciate it. But unless you mention it, it might not be the
No,
case. So I think
it's
just
really important.
yeah. So I think Thanksgiving gives that opportunity, for people to speak to their friends and their relatives in that way, and have that be part of the practice.
Well, the other thing that psychologists are starting to explore is do daily acts of kindness to people you know and people you don't know also affect your psychobiology. I mean, I think this is a really interesting. This was considered sort of out there, but how you're how or sort of not tied to sort of the hard numbers of medicine, but increasingly we're finding that daily acts of gratitude and kindness really can help lift your social wellness, and can kind of help build resilience in all of our psychological makeup. And I think it's not just our spouses and our partners and our kids and our family members. At least most of my family members, I'm grateful for. But it's trying to find ways to integrate that into your everyday life, and I think that's really the lesson of Thanksgiving. It's in addition to the food and the accidents, it's really taking that gem of a feeling and trying to kind of find it every day or express it every day, and that I think probably is the most powerful message we can deliver to our listeners on Thanksgiving. Once they get beyond the warning label of all the things that can go wrong from healthcare, here's one of the things that could be right that you could integrate into your everyday.
That sounds good, John. And since we are, healthcare wonks and not just the self-help people, I did see in the research that there's also evidence of gratitude being able to help to transform the patient-caregiver relationship and improve patient satisfaction and boost staff morale. So it's not just within the confines of one's Thanksgiving dinner table, but I think we saw this also during the pandemic in terms of some of the gratitude that was expressed toward the frontline workers and people putting themselves at risk, and it's probably should be carried over more broadly.
Yeah, no, we could definitely in many ways. Patients feel a little bit too much like a vehicle for payment or transaction, or a part of it in the massive industry of healthcare, as opposed to connecting and feeling cared for. And maybe that's another way that the healthcare system could work a little bit harder on integrating gratitude, and actually even more than gratitude, kindness into all of the different pieces of whether it's how you show up at for patients when you're bringing them through their massive paperwork, or moving them down the hallway, or just connecting with them in the patient waiting rooms. It's one of the things I think one of the reasons why people love doctors, and but particularly nurses, because they in many cases practice kindness every day, and maybe that's a lesson for all of us on the clinical and the non-clinical side of healthcare.
Well, that's it for yet another episode of CareTalk. We've been talking about Thanksgiving. I'm getting ready to dig into the turkey, but I'll use a special rubberized glove so I avoid any problems. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service. And David, happy Thanksgiving, and happy Thanksgiving to all of our listeners.